All right, hey ladies. Two of my clients are here so far. I appreciate y'all so much and I love y'all. It is your favorite doula, Naya here. We are recording this. I'm gonna go ahead and put it on YouTube eventually. It takes me forever to upload anything on YouTube, but this is my breastfeeding 101 class. It's an opportunity for me to share my experiences. I am a mother of 5 and I started my motherhood journey at the tender age of 15, and I breastfed every last one of them. And I had a different experience each time. It's also an opportunity for my clients, or if any other mothers want to join and share their experiences, share any of their wealth of wisdom. It's really, really greatly appreciated. So we're going to start off with the boring stuff. The very boring stuff, the science of lactation. Okay, so I can see if your hand is raised. If you have a question, please try to keep your cameras, keep your videos on mute. And if you look down at the bottom of the Zoom screen, there is a button called reactions. And you can press the reactions button and then raise your hand. And then, and I can see it. I can go ahead and get to your question, okay? All right, so the science of lactation. Can someone exclusively breastfeed on one breast, or do they need to use 2 breasts? Well, with twins, yes. But if someone has a large amount of milk producing glands called alveoli, it can be possible to breastfeed on one breast for like per feed. So basically each sitting. All right. However, it is preferred in the modern breastfeeding culture to start by using both breasts at a feeding. One of the sayings that go is the first breast is dinner, the second is dessert. Okay. And then on the screen, you can see here a picture of the areola, the nipple with the multiple openings, the ribs, the muscle layer. I actually have that here. I hope you can see it. And you might be able to hear my loud kids in the background being loud, having way too much fun. Like they went to camp and they still have energy, whatever. Okay, anyway. But I have that here. This is the muscle layer. So one of the rules to breastfeeding is to try to ensure that you are sitting comfortably. Okay, your breast and the milk, and you know this is milk ducts. All of this is being supported by this muscle, by your spine. So comfort is one of the biggest challenges to women in breastfeeding, from my experience, from what I see working, and from being a mom myself. Comfort has been one of the biggest challenges. To sit comfortably, it might mean that, you know, you go and you get an airplane pillow for your neck, a neck pillow. It might mean you get a back pillow, especially while you're pregnant, like especially for breastfeeding. It might mean you get a boppy or some kind of pillow to support the baby. It's all worth it because you don't want to overlook your comfort while nursing. Nursing can be uncomfortable just for biological reasons. So you don't want it to be uncomfortable for non-biological reasons that is in your control, okay? You have here what's called the lactiferous sinus and the lactiferous duct, okay? So that's these. I don't know if you can see it. I hope it's close enough, but that's these ducts. They fill up. They lactate. That's where the word lactating comes from, okay? Let's go to the next. All right, so this is more physiological information. So estrogen is needed to grow mammary ducts and tissues. Progesterone is produced in the ovaries and the placenta and is essential for developing the milk secreting cells in the breasts. When the placenta is expelled after birth, the body knows the pregnancy is over. Then the pregnancy hormones decrease and milk-making hormones increase. A retained placenta can impair lactogenesis and inhibit the hormone prolactin from rising and making copious amounts of milk. So some women who have had struggles in producing breast milk didn't realize they still had some of the placenta left behind, and they had to go back. So, it's important that all comes out intact. If you see any large blood clots, it's important to go ahead and let your doctor or midwife know. Like blood clots that are larger than what I was told, a quarter, and it's really, really consistent, you really want to let somebody know, just to make sure you're not retaining any placenta, especially if you had a hard time producing milk, okay? That's one sign. And you don't want to get infection. Retained placenta can cause infection. So like I said, lack of production of breast milk is a sign of that. Okay. Prolactin is one of the two main hormones of lactation. Prolactin is released as the baby or pump suckles the breast to trigger mom's body to make more milk. So demand creates supply. So yes, the more you pump and the more you feed the baby, the more milk you produce. Okay. Oxytocin. Oxytocin is released as baby or her pump suckles at the breast and sends messages to the muscle layer of the milk producing cells to let the milk out. Oxytocin production and letdown are extremely important for successful breastfeeding. Fatigue, anxiety, fear, or pain can inhibit letdown for some mothers. All right. So prolactin and oxytocin are, of course, the most popular, the most mentioned hormones involved, but the estrogen and progesterone balance is very important as well. So I know that stress and fear are among. I'm sorry, hold on, my kids are way too loud. I'll be right back. All right. My bad, ladies. I'm so sorry. Okay. They were having whole jungle gym time. So, what was I saying? Okay. So yes, the estrogen and progesterone that's needed. A lot of times women will try to take things that produce more estrogen out of fear of a hard labor. Sometimes mothers will take different hormones, like what is it, the raspberry leaf, different things to help slide the baby out, quote unquote. And sometimes it's too much. So I always encourage mothers to be careful with adding extra or taking extra supplements. Like, your body will supply what you need. Your body's doing a great job. Your labor is going to go smoothly. Your body's going to release everything the way it needs to. Like, your body doesn't lack anything. There's nothing about you that is lacking. There's nothing about you that is, if you went full term, you carry the pregnancy, there's nothing about you that is insufficient at all. Okay. Be careful, because these two hormones do need to be balanced in order to produce the proper amount of breast milk after birth. And then the prolactin and oxytocin. So your body is going to be your body's going to have a surplus of these two hormones in your bloodstream because of labor. That's the importance of the labor and delivery process. Even if you're getting a cesarean and you don't have to have a long labor, just your body releasing the baby is going to produce that oxytocin and that prolactin because of the removal of the placenta. So remember that stress and fear are among the reasons many parents need a counselor to help them through the emotional challenges of motherhood. So that oxytocin is released. Oxytocin is what induces labor, right? So it helps to get the baby out. Oxytocin is going to trigger contractions of the uterus whenever you start to nurse, when the baby first comes out. So the oxytocin that gets you, so this is the ovulation wheel, the ovulation track, right? You start off at this little one centimeter, then you have here 2 centimeters here. Okay. And then it goes all the way up into 10. This is how you get the baby out. So your body's going to have to go from this 10 and go backwards. And it's going to do a great job in doing so. The way it did a great job opening, it's the oxytocin that opened you up to this 10 is going to be the same oxytocin that's going to get you back to this 1. So as far as your cervix is concerned, breastfeeding is very, very beneficial for the return to typical size. It will cause some discomfort. Normally, if you're taking a Tylenol or ibuprofen or anything, that is enough to handle whatever discomfort you'll feel with the breastfeeding. It's not too bad. Don't be stressed out about it. Don't be fearful, because it's typical, it's normal, it's natural, and it lets you know that everything's working properly. Okay. And let me make sure I don't have any hands up. Any questions? Okay. All right. So this is an article about foremilk and hindmilk. So it says, as baby needs that balance of foremilk and hindmilk, you will want to be sure you encourage parents to not restrict baby's time at the first breast. Babies should be allowed to finish feeding on the first breast in their own time, then get the second breast to finish up. Think of the first as a meal and the second as dessert. There was a time when parents were told 5 minutes aside. Then it became up to 15 minutes aside. Now we know to let babies nurse anywhere from 15 to 30. Really, baby's own timeline. Some babies need the milk stored in both breasts to be full, while other babies will be satiated feeding on only one side. Over the course of 24 hours, babies should have nursed a minimum of 8 times, often more, and the parent should be able to make enough milk for each day. So when I had my first baby back in the early 2000s, back in 2004, I had my first child, and that was during the time where they were still telling us, 20 minutes or 30 minutes on a breast and then switch over. So that's what I was doing. I was a teenager. I didn't know any better. I was following rules the way it was written, okay? I wasn't using any discernment because I've never been a mother before. And my mom, I guess, she just followed what doctor said. So that would explain why my baby was skinny. I didn't allow her to feed on each breast until it emptied the breast. And I didn't have a breast pump for a while. And that foremilk and that hindmilk. So if you look at cow's milk, if you ever seen cow's milk, the whole milk looks all nice and thick, and it's not transparent, okay? But then you have a more transparent milk. It's full of water. Normally, this watery, transparent milk is more like a 1% milk, where there's not a lot of the fats that the baby needs. And this comes out within normally like the first maybe 10, 15 minutes of nursing. Versus, so I hope, everybody can see the difference. I can see like the color adjusting. I hope you can see the difference here. One of these is looking a lot more transparent, and the other is looking nice and full. You want the baby to get both of those. If you are going to be a breast pumping mother, that's awesome. I completely encourage breast pumping. And we're going to get into that in a minute. But if you're going to be a breast pumping mother, you will see the foremilk come out first, and you will see the hindmilk come out next. I like to mix them together so that my baby's not constipated. Human fats from breast milk can make baby constipated. A lot of breastfed babies are constipated. The pediatricians tell us that it's normal for a little baby or a newborn to not poop for days on breast milk. There's not a lot of toxins in it, so there's nothing to be afraid of. But I personally don't like it because I like for my babies to release their bilirubin from their blood. So the more poop and pee they release, the more bilirubin is released from their bloodstream, from their bodies. And so I like to milk. I mean, I like to mix whenever I have babies and I breast pump, I mix both because I can clearly see the difference in the whole milk that I produce and like the 1% milk. And I was following those rules as a teenager, and I had a little skinny baby. Every time I went to go take her to the doctor, to the pediatrician, they thought I was being a teenager and being irresponsible and not feeding the baby enough. And they were coming up with all kind of scenarios of why my baby wasn't gaining weight with the higher percentile. She was healthy. She had healthy fats on her, but she wasn't gaining weight as fast. And it's because I was taking her off of the breast too soon. Just following rules. So, and as you can see here, as time goes along, we gain more knowledge through research, and things are a little better for us, a little healthier for us. But yes, our bodies do like this 1% whole milk method. So you want to mix your milks if you're pumping, and if you're not pumping, just make sure your baby gets to stay on long enough to get the good thick whole milk. Okay. And then we have birth to full lactation. The first milk, also called pre-milk, is colostrum and is measured in teaspoons, not ounces. All right, because you don't have a whole lot of colostrum at first. The colostrum helps to prepare the baby to be able to tolerate your milk. The colostrum smells and tastes like amniotic fluid to the baby. Okay, so it helps your baby to transition from the womb to being able to eat on its own. Okay. Regardless of gestational age, whether premature or 32 weeks or full term at 40 weeks, there are teaspoonfuls of milk waiting to be suckled or pumped in the case of extreme prematurity from the breast. As colostrum is concentrated form of milk. I'm sorry, I typed that wrong. As colostrum is a concentrated form of milk, the newborn does not need much in the first 72 hours. Some babies also swallow large amounts of amniotic fluid before birth and thus are not ready for much milk right away. So your baby sometimes can come out full, okay? Now, if your water breaks, then of course your baby isn't swallowing large amounts of anything. Like if your water broke hours and hours before delivery, okay? So everybody's labor and delivery experience is different. When baby emerges from the uterus, the placenta follows. When the placenta is expelled, the body receives a signal the pregnancy is over and the milk-making hormones begin to rise. According to research, contractions in labor prepare a baby for nursing by activating their olfactory membranes. Being able to smell aids in lactation. Being able to smell aids in lactation. So olfactory is just the sense of smell. When the baby can smell that colostrum, it smells like the amniotic fluid, and that's how the baby knows that this is where I drink. This is where I latch on to, okay? Research also tells us that a mother's colostrum smells and tastes like her amniotic fluid, which helps with the first latch. When baby is born, they instinctively look for the dark nipple, the smell of colostrum, and then they have the ability to latch if they are centered on the nipple. So, of course, as doulas, we encourage that time of, we encourage that latching time. We encourage that time for the mother bonding, skin to skin contact. Sorry, I couldn't get the words in my head. Skin to skin contact. All right. So you might be a mother that decides to pump milk. In some, everybody's case is so different. Some cases, it has to be a situation where the mother, there it is. All right, in some cases, the mother needs to be separated from the babies. In some cases, they don't. But in all cases, you have an option to use a breast pump, okay? And if you decide to use a breast pump, my main concern as a doula is helping you to find the right size, okay? The flanges of the breast pump are very, very important. And There we go. You can have flanges that are too small. So the flange is like the opening, the plastic opening of the breast pump that meets your breast. Okay. Let me make sure I'm in view. This here. Can you guys see me? Can you put in the chat if you are able to see this breast that I'm holding? I just want to make sure. All right, perfect. Thank you. Thank you, Chelsea. All right. So this is about the average size of a breast. This round, like, I mean, all moms are different. I mean, my boobs aren't this. So I wish my boob was like this, but it's not. All moms are different. But this round fullness of it kind of represents a mother that is, I would say, engorged, or her breast, her breast is full, okay, with the milk. These clips, these binder clips, these paper binder clips are like perfect for practicing that latching, because you want the baby to get a good latch the same way. If you have to get a breast pump, you want to get a good size, because you don't want any air pockets, you don't want any spaces in between the latch. Okay, I'm gonna take the glasses off. You want a good tight fit, not too small, not too tight, because of course if it's too tight with the baby, it can hurt. With the baby, you don't want to be latching on the very end here, the very end of the nipple. You want to latch on to the whole areola, okay? Try to get as much of the areola in the baby's mouth as you can, and it won't hurt. Like, you won't feel so much discomfort when it comes to the breast. You will start to have some contractions. You'll feel those, but it won't be too bad. But I know from my experiences, guys, it was like night and day. Me producing breast milk, in pain or not in pain, was really dependent on me and my kids' latch. So these binder clips they have enough resistance for you to like practice latching. But yes, you want to try to open your baby's mouth. These binder clips match the resistance of like a newborn baby, getting a baby's mouth open. And you want to get as much of that areola in the baby's mouth as possible to get a good latch. And then with the flanges of the breast pump, you want to get, you can go ahead and refer to the picture on the screen, but you want to get a good size suction that like won't allow any air in. You don't want any side air pockets. All right. And then in order to release the baby from the latch, you just want to take your pinky and grab the side of the baby's mouth. It will release whatever latch the baby has on your nipple. What you never do, and I mean never, if you love yourself, your baby, and your breast, what you never ever do in this life is snatch your nipple out of the baby's mouth when the baby is fully engaged and latched. You will feel why I said that if you do that. I mean, you can try it if you want to. You can mess around and find out, but I don't recommend it. To me, it's dangerous if you ask me, but the baby can choke if the baby is not expected to be detached, and it hurts. It's like, having to pull something and then it snaps it back like a rubber band. It hurts, okay? It's painful. I don't recommend anybody doing anything dangerous like that, okay? And I know when it comes to breast pumping, I love it. I know that there are new breast pumps out now they're a little more expensive, but you can put them on your breast. They fit inside of your bra, and you can walk around, functioning while you're producing the milk and while you're pumping. That's great for convenience if you don't have the opportunity to just sit down and rest and pump the breast milk, okay? But the typical breast pumps, you sit down, just remember to clean each part of them. So, okay, pros and cons to breast pumping. I'm going to go over that really quickly. The pros to breast pumping is convenience, and you get to build up a supply of milk for your baby whenever you're not with your baby. You don't have to spend every waking moment with your baby, okay? That is the pros. The cons is the inconvenience of having to clean the different parts of the breast pump because you already have plenty of chores to do. You're trying to rest, you're postpartum. Your family is managing, and then on top of that, you have bottles and breast pump pieces to go ahead and clean. Now, granted, you can quickly clean them all. You can boil one big pot of water, wash them out with some soap and water, boil one big pot of water, put it all in there, sterilize it all together. That's what I used to do. It was nice and quick. It wasn't too much. But people get microwave sterilizers. Maybe that you don't want to do the pot of water. Some moms who I know have been by themselves, they tried the pot of water sterilizing method, and I did this once. I'm guilty. I've done this once. I started the pot of water sterilizing method and left the water on, and the water burnt out, and I was cooking silicone nipples and cooking breast pump pieces. So sometimes it's not the most convenient. Sometimes it's good to go ahead and use the microwave sterilizer. There's nothing wrong with it. But yeah, it just adds sometimes the extra work to nursing. And some moms I appreciated it. I was ready. I was built for it. Some moms are not. And, every mom's life is different. Every mother's circumstances are different. So what you choose has to be what's best for you. But feel free to try different things out. There's also hand pumps. So when I was about 8 weeks postpartum, I went on a girls trip, a 4-day girls trip, and I had to take my hand pump with me because I was, I'll become engorged. And I actually didn't take it with me. I forgot. I went to Puerto Rico. I forgot my pump at home. So when I got to Puerto Rico, I had to go to Walmart and I had to buy a hand pump because I was in pain. My boobs were like on water balloons, swole. So I had to go ahead and purchase one from Puerto Rico. It was like $18 or something like that. So I can relieve myself. They're really, really good for on the go because they don't have the electricity and everything. They don't have a whole bunch of moving parts. It goes right into the bottle. And then, you put the bottle nipple on the bottle, or you can just pour it out, whatever. But that's an option. Just do your best to make sure you measure the sizes of the flanges to your breast. Don't get one that's too small because that can cause pain. Don't get one that's too big because that can cause an insufficient suction. Okay. Any questions for anybody there? If you want to unmute and ask any questions, feel free. If not, I'm going to go on to talk about what me as a doula, what I like for women to eat to produce breast milk. So if you are between 35, I would say 35 and 40 weeks, I personally, as your doula, I want you to eat sweet potatoes. If some people don't like yams, some people don't like sweet potatoes, yams is great. Or white potatoes. Here's why. You want to send your body a signal that you're getting enough nutrients without overeating. With the baby being full term in your belly, there's not a lot of space for big, heavy meals. So you want to be able to get the most calories and the most hormone balance out of each meal. Yams is really, really good for that hormonal balance of progesterone and estrogen and calories. You get a good amount of calories, and your breast milk will be a little sweet for the baby because they're naturally sweet, but it tastes good to you. It satisfies a lot of the sugary cravings that we get as breastfeeding mothers. I don't know about y'all, but I was craving so much sugar, and it's because my body was triggering me to get more calories to accommodate the breastfeeding that I was doing, so accommodate me putting the fat and the water out. Okay. Drink more than enough water at all times. Coconut water, add it to your juices and add it to your drinks. The level of potassium in coconut water will help you to produce breast milk because it sends a signal to your body that you're good and hydrated. You have more than enough hydration to share with the baby. coconut water is good with the sodium potassium balance. Okay. Um, but just definitely, and sometimes when you're nursing, I encourage everyone to make sure you are nursing somewhere that is safe for you to kind of rest your head. Even if you're not laying down, if you're sitting with your back up on the bed with your back to the headboard, nursing can sometimes immediately cause lightheadedness, and I don't want it to be dangerous. So make sure you're not just holding your baby and this is early postpartum. I'm talking like under 2 months, like within the first 8 weeks of postpartum. Just try to be in a position where you and the baby can be comfortable and be safe. I know within that first 8 weeks of nursing, after I had the baby, I would kind of pass out. Like I could feel my water. I felt like I could feel my fluids leaving my body from the ducts that connect here. And I would get lightheaded. So I'd be holding the baby and I'd be nursing. I really, really appreciated the football hold. There's many positions that you can hold your baby in. My most comfortable was the football hold, and that's where the baby is in my arm, and I'm holding the baby's head in my hand this way. So I would be doing like a football hold, guys, like this, but I would be like dozing off. So I had pillows and I had barriers around me to catch the baby in case I kind of fell asleep nursing the baby. Nursing can cause severe sleepiness immediately. Okay, it's just an experience. And so I just want everybody to be sure that they're safe. I used to put my baby upright in a strap-on carrier sometimes to nurse, and that would help me as well. Because it's hands-free. And this is when she was small enough. All of them, whenever they were small enough, I could nurse them a little bit, depending on the size of your breast, of course, but I can nurse them easily with them being in like some kind of strap-on carrier to free up my hands. And make sure you're drinking water. Make sure you have invest in cups. Okay, I like to invest in cups. I am the queen of pretty cups because you're gonna want to get your money's worth. Just invest and invest and invest in cups. You're gonna, if they're pretty and you like them, you're gonna want to use them. You're going to keep water in them. You're going to keep some kind of drink, something near you. You're going to keep something in them, okay? I go to Rainbow and I grab up all of their $7, $8 cups that are really, really cute. I keep a cute cup of something close by at all times. I want you hydrated. As your doula, I want you hydrated. You know, if you're drinking juice, throw a little bit of coconut water in there, okay? You have to make the most out of what you eat. What I also love, if you're after 35 weeks, chickpeas. Chickpeas taste really, really good. They're called garbanzo beans. All right. Chickpeas taste really, really great. And I personally, I like chickpeas. Let me move the boob off of the screen. Okay. All right. Can you guys still see me on the screen in full? All right. All right. Thank you, Chelsea. Okay. All right. So, um, chickpeas is really, really high in vitamin K. It has been, studies have shown that apparently breast milk is low in vitamin K. Like the babies don't get enough vitamin K from breast milk, apparently. I know that garbanzo beans, you can get them in a can at the store, or you can soak some and cook them like, you know, long ways, old school, where you gotta boil them for about an hour after soaking them for like 4 hours. But you can get them, you know, in a can, pre-soaked and everything. And they taste delicious. Y'all, I love some chickpeas. I know me as a doula, I like to prepare meals during labor and delivery. I like to prepare my celebrities' meals. So whenever I am your doula, there's a crock pot going while you're in labor. You'll be able to smell it. But I am preparing some yams, some chickpeas with some kind of cooking peppers in it. If you eat meat, then I'm hooking up your chicken or whatever meat you would like. But I like to include a first meal for my celebrities. And then when I come to your house for your postpartum care, I also make you some meals. I'll make you a big container of like lemonade or iced tea, whatever you like to drink. I'm going to add some coconut water to it or some kind of electrolyte to it. That's how I care for my clients, because it's important that you be intentional with inclusion in your diet. Your body is going to take from you and give to the baby. So the part where it's taking from you, you want to make sure you still have sufficient vitamins and minerals. Like you want to have an adequate amount in your diet. So eating chickpeas, it's really, really good for that estrogen and progesterone balance. And they taste delicious. It's mostly fiber, and it's mostly fiber and carbohydrates, but it's high in vitamin K, which is what they say we're insufficient in with our breast milk. But chickpeas is not as popular here in the U.S. as it is like in Puerto Rico among Spanish women. Like they're called garbanzo beans. So different cultures that are outside of the U.S. a lot of times they're not insufficient in vitamin K because they're eating a large amount of beans and rice and things of that nature. Okay, so also oatmeal. Oatmeal is a win. Okay, oatmeal is a win. It produces a good amount of progesterone in your body. And the calorie count. The calories in oatmeal will help you to basically send your body a message that it's safe to produce plenty of milk. That's what you want. You want to send your body a message that, hey, we have adequate nutrition, we have adequate calories. You know, make food for the baby ASAP, okay? Whenever we start to wean ourselves off of food and calories out of an attempt to think that, we're fat and we want to avoid the carbs and we want to, don't do any of that. Don't do any of that. Postpartum period, breastfeeding period is not the time to go on a diet. If you go on a diet, your baby's going to go on a diet too, because your body is going to serve you first. Your body is going to prioritize you. So in prioritizing you, if you aren't showing up with a certain calorie count, well, it can come out of your breast milk, okay? And you don't want to lower your supply. But I like oatmeal because it's not fattening like a bag of chips. It's not fattening like bread. It's not fattening like eating bagels all day. If you love bagels, go for it. Bagels are good, it's good calories, but it's not that kind of fattening. Oatmeal is really, really good for you. And the progesterone that gets extracted out of oatmeal produces a lot of breast milk. Like I know women who eat oatmeal cookies for their snack when they are nursing, and it helps them to produce a lot of breast milk. A drink with some coconut water and a pack of oatmeal cookies, and you will be producing gallons because of, again, the electrolyte balance and the calorie count and the progesterone that come with the oatmeal and the cookies. All right. So those are just a couple of things. Like I said, after you're 35 weeks plus, I like for my mommies to start eating the meals with the chickpeas, the garbanzo beans, that's chickpeas. The yams, it's good to start eating your yams now and make sure, you're staying hydrated. Is there any questions so far? Also, any constipation that can come with like postpartum, that postpartum period, the oatmeal will help with that. Yes, steel cut oats. Steel cut oats are my favorite. That's my go-to because I like to be able to add my own stuff in my oatmeal. So instead of getting like the flavored strawberries and cream oatmeal, I'm not saying anything's wrong with those, but I feel like the steel cut oats, they're a little bit bigger and heavier, and you add your own to it. Like normally, well, I know the steel cut oats that I buy are plain, and I can add my own stuff to it. For my oatmeals, I used to chop up green apples Granny Smith or the Golden Delicious. I would chop up green apples and put the apples in my oatmeal, and I would drizzle it with some caramel syrup. So I was eating caramel apple oatmeal, and it was so good while I was nursing. Oh my gosh, y'all, it was so good. It was delicious. It was so delicious. But the apples could help with the constipation. The caramel syrup was enough sugar for me not to put too much sugar in my oatmeal to give the oatmeal that buttery taste and to add that salty sweet flavor that we all like in our oatmeal. And the apples were light. Apples are excellent for you while you're nursing, by the way. It helps keep you regulated, and the baby can taste apples. Apples taste really good in breast milk. Yes. Yep, we get the big bags. Exactly, exactly. Agave syrup. That's awesome. That's awesome. Apples are good for the calorie count too. Just adding fruit to your oatmeal is good, but apples in particular is a go-to. Um, and other than that, you definitely want to avoid any drinking. I know a lot of us mothers are excited to get a drink after pregnancy because we couldn't drink all pregnancy long. But yes, alcohol does pass into the breast milk, so you want to be careful with that. Just tread lightly, and dilute yourself with water. So basically, if you're breastfeeding, there's not going to be a bunch of getting drunk, whereas your bloodstream is diluted with alcohol. There's not going to be a bunch of getting drunk. It's going to be more of just, if you have a light drink here or there, that's fine, but just, make sure you're diluting. I had some drinks here and there when I was in the postpartum period and when I was nursing, and it didn't seem to hurt any of my kids at all. It didn't hurt me, but I can honestly say that at no point was I getting drunk while I was nursing. So let's see. Is there anything else that I'm forgetting to go over? And does anybody have any questions? My intention for this call was to be about 45 minutes to an hour long. And if nobody has any questions, if you can hear me, she's an experienced mother. She's one of my clients. I wanted her to go ahead and share some of her breastfeeding journey. If she could hear me, my baby mama. All right. So she might be busy. I appreciate her being on the call. She might be busy doing something. But Chelsea, do you have any questions for me? You can unmute if you need to.
I do have a question. So I haven't looked at my pump in a while, but I got a free pump, and I have a girl that I know who told me I need to get like a sizing kit online with like flanges and stuff. So I wasn't sure if like that usually comes with the pump or if I need to go ahead and get it separately.
In my experiences, when I've gotten my breast pumps and when I've seen others, they normally came with about 3 sizes. It was like a small, medium, large. And and I would use whichever one would complement me at the time. And the reason why I said at the time is because your breasts grow throughout the breastfeeding journey. So if I've been engorged for hours because I haven't gotten a chance to get to the baby, I've been out and the baby's drinking the bottles that I left at home, the milk that I left at home, for whatever reason, my breast would like double in size from the milk. So that means I need to use a larger flange at that point versus trying to fit my big old engorged boob into the flange of when I'm not, I'm not engorged. And then if I've been feeding the baby every 2 to 3 hours and my breasts aren't engorged, then I need to use a medium flange. So I noticed that the pumps come now, and this is me talking Medela. My pumps were Medela. I had one pump that was the brand called Amida, and that's AMEDA. I had an Amida pump and it worked well, but it didn't come with any accessories. My Medela pumps came with a bunch of different accessories and all the small parts. And, you know, we can get into that, going over the small parts to a pump at a different time. But the Medela pumps came with like the 3 different sizes, like the small, medium, large. And if none of them fit, that's when I would research more sizes. Because see, it could be a one size fits all, but sometimes it's not. Your main concern is making sure that if it's too small, you're gonna get too tight of a suction, and you're gonna know it because it hurts. And it's it's more uncomfortable. It hurts more than the baby latching on, basically. And then if it's too big, you're gonna notice that it's not like a sufficient latch, like it's not pulling milk enough, so it's like it's not close enough. So if you and your baby can go ahead and get a good latch going, you want to choose a size that imitates what feels like your baby's latch. If you and your baby can establish a good feeding latch. Does that make any sense?
Yes, that makes sense.
Okay. And then I was gonna say something else. Oh, where is it? Okay, hold on. I like to use for your nipples. That's what I want to go over. For your nipple care, I was using the lanolin. Lanolin worked really well for me. It was really, really sticky though. So the lanolin, it was really good for keeping the baby's lips from being dry. Some babies get really, really heavy, dry lips. And you'll notice that if your baby doesn't have a good latch, there will be like what looks to kind of be blisters on the inside of the baby's lips. It looks like dry skin, but it's from the baby not getting a good latch, because the baby's mouth should be latched past the lips. If you can see that there, like if you imagine this is the lips of the baby, no, the baby should be latched on the inside, like more inside of the mouth. You don't want the baby to have a superficial latch just on the top of the lips. It'll hurt you and it's not good for the baby. But vitamin E. So I would get my vitamin E capsules, and I would take a vitamin E capsule and I would like pierce it, like my teeth, like maybe bite it. And I don't know if you can see, but I would like take the jelly from the vitamin E and use it for my nipples, because I know it will be good for the baby and good for my skin. It's not harmful or unhealthy for the baby. I knew it wouldn't break the baby's skin out, and it's thick and it has the right consistency to protect your nipples, but it's not as thick as the lanolin. Sometimes, in my opinion, the lanolin was a little bit too thick. So just for nipple care. Also, this is of major importance because it's not talked about enough. It's not considered enough. Baking soda and water, okay? And I had some nearby. Hold on, because I almost forgot. Okay. You want to use a little spray bottle like this with some baking soda and water. When you are done, you can spray it inside of your breast pump pieces, like your flange. You can spray it in there, but spray it on your nipples and take a Q-tip. You can open it up, take a Q-tip, put it inside, and you need to wipe out the inside of the baby's mouth with a little bit of baking soda water. And don't make the concentration of the baking soda too high. Just, just a little. Like I would say like maybe a finger pinch of baking soda. Or if you do, let's say like a half a teaspoon of baking soda to a little bottle of water like this. Keep this nearby. I used to sit this in my breast pump so I wouldn't forget. It will stop your baby from getting thrush. Breast milk causes thrush, and it sits on the inside of the baby's mouth, and it causes a heavy white fungus that hurts the baby and makes the baby itch, but your breast will also get the thrush, and it hurts you as well. And after every feeding, if you take a Q-tip and just wipe the baby's mouth out with the baking soda and water. It won't hurt the baby. It won't cause the baby gas or anything, but your baby will not get thrush. So when I was 14 and I was a breastfeeding mom, my baby got thrush and I thought she was spitting up the milk. I saw all the white. It's a yeast infection. I saw all of the white coming out of her lips and I saw it on her tongue. I thought it was spit up. I thought it was normal. No, my baby had a horrible thrush infection from breastfeeding, and it comes from bottle feeding too. So you want to avoid that. You can clean off your nipples with it and clean out the baby's mouth with it, and it'll be sufficient to protect from any of that. That is a must-have hack, and they don't talk about it enough, in my opinion, because of how much money is made from a yeast infection, a baby's mouth getting yeast, because that's what it is. You know, they sell medicine and stuff for it. I'm like, why would the pediatricians not just tell everybody to use some baking soda and water? It's an antifungal. Baking soda is an antifungal, and the sodium component of baking soda protects against bacteria. So like I said, a go-to, a must-have next to your pump or just next to where you feed or in your purse or in your bag, just make a few little bottles of just some plain baking soda and water, like a little bit of baking soda, fill it up with water, and you're good to go. And like I said, for nipple care, I like to use the vitamin E. This is from Walmart as well. I like to use vitamin E capsules. All right, the little. Any more questions? Dede, are you with us yet?
Do you have any bottle recommendations that are like more similar to for breastfeeding babies?
My favorite, Chelsea, was the Advent bottles that were glass.
Oh, that's what I have on my registry. I was waiting on somebody to get it, but nobody got it.
Yeah, Go ahead.
They're expensive.
Yeah. Okay, so the beautiful thing about the glass bottles are that glass is non-porous, so you don't have to have any kind of complex about getting them secondhand. That's definitely something that you would get on Facebook Marketplace and look for. Okay, that is a Facebook Marketplace. Goodbye. Even if they sell just the glass bottles and the white tops, they vent really, really well. For them to be glass, I was really shocked at the technology and how well those bottles vent, because that's what you want to be concerned. You want to make sure your bottles are venting well, and you want to make sure the shape of the bottle nipple is good. The bottle nipple that matched my breast in particular the best was the Advent glass bottles. And their silicone nipples that they came with for the Advent glass bottles. And again, this is also back in 2017, between 2017 and 2020. Okay. My youngest baby is 4 years old. So every year they come out with better bottles and new stuff. But that's the size. That was like the best imitation of my breast. You want to go and get a nipple. Of course, that's silicone. You want to get a nipple that matches the size of your breast the best. Just so that your baby can have a smooth transition between bottle and breast. Because you don't want to confuse the baby. But as far as the venting went, Advent was the win for me for some years. And Dr. Brown's didn't match the size of my breast, but my kid took it with no problem and it vented pretty good. But with Dr. Brown's, you just have the extra pieces like the straw and stuff. I got to the point where I was using Dr. Brown's without the straw and without the extra pieces, and it was working pretty good for my kids. So just, you just want to make sure it's venting good. But that's my recommendation. That I can only recommend what I use as a mom. So hope it helps. Any more? Dede, are you with us yet? She probably busy or she sleep. I appreciate her for getting on. Dede, God bless you. my baby mama Day, I can't wait for her to have her baby. She is having twins, and she's pregnant with twins. She's carrying them full term beautifully. So she might be over there. She might even be over there dozed off. I wouldn't be surprised. But you know, she's trying to be supportive. She tried to get on. And Chelsea, thank you so much for asking your questions and for getting on. Are you at work?
Yes, I'm at work. There's nothing going on now, though.
Okay, so thank you so much. I'm so glad that you was able to get on the call, and I hope you were able to learn some stuff. You know, all you got to do is reach out to me, and I'm gonna send you screenshots, paperwork, answer questions, whatever you need. You already know.
Okay. I'm still waiting on those video links for you were telling me that when we were on the phone the last time, there was like a link that you were going to send me to your YouTube.
Yes. Okay. So thank you for bearing with me. So, okay. I uploaded some of them. I have to go ahead and release them. There are a few more that I have to upload. But it's the labor and delivery poses. That's what I'm working on the most. So I'm gonna upload them. I'm gonna be uploading them tomorrow. I know every time I talk to you, I'm saying it's the day away, it's the day away, it's the next day. But I promise you, before you go in labor, Chelsea, like, you know, and I mean this week I'm gonna get it done. Before you go in labor, I will have them uploaded so that you and your husband can practice the poses and the positions and you know the pain relieving techniques. I promise.
Your time.
No,
Hopefully
girl.
he's not here for another like couple weeks.
Yeah. Hopefully you definitely get that time. But I can definitely tell that there has been an increase in your confidence and your joy, and that's why you're seeing the early symptoms that he's basically the warning signs that he's coming soon. It's because you're confident and you're comfortable. So that's the way you want to keep that same energy during labor. That's what's important.
Okay.
And I'm just so happy for you and for Dejan. Dejan is on there carrying our twins. Pretty sure she said she's having twin boys. I'm just excited, you guys. And again, I'm going to finish uploading to YouTube. I promise. I love you so much. Thank you so much for getting on a call. All right. I will talk to you ladies soon.
All right. It's good talking.